and welcome to all of our Gold viewers. I'm Fiona Lang-Sharp, IBCLC and Public Relations Manager and MC for the Gold Lactation Online Conference 2015. I would like to welcome our guest today, who is Dr. Sushma Malik, and she's going to be sharing with us about the impact of mother support groups in an institutional setup in a developing country. Thank you so much for sitting down with me today, Sushma. It's lovely to have you.
Welcome, Fiona, and thanks to Gold Lactation for giving me this opportunity to talk this year in your conference.
Well, thank you. We're very excited to hear more about your presentation. So I have some questions for you today, and I just want you to give us just a little snippet of what to look forward to coming up with your presentation. So firstly, I would love to know, when did you first become interested in the mother support group?
Well, I'm a professor of pediatrics and I head neonatology at TN Medical College and BYL Nair Hospital, which is a 1,300 bedded major teaching hospital. Basically, it caters to, largely to needs of people belonging to lower and middle income groups, and we handle more than 4,000 deliveries each year. So one of the challenges for my team of doctors has been that we have been unable to spend enough time with our mothers, to guide them, support them, counsel for the best breastfeeding practices. This is despite my being personally having a passion for breastfeeding promotion and support and being the president of Mumbai Breastfeeding Promotion Committee. There was clearly a missing link between the doctors and mothers. And this link was provided by the introduction of mother support groups, as they were my best option available for us. And I could see that they were very effective in implementing my infant and young child feeding practices. As we all know, that the key to the breastfeeding practices is continued support and counseling. And this was provided by my mother support group.
Well,
That's
is
what
wonderful.
made me really interested, and I got very excited with the results of improvement of breastfeeding practices.
Yes, absolutely. And can you tell me what sort of changes have you seen from being involved with these groups?
Well, the impact of this initiative was really phenomenal. And in a period of 5 years, the percentage of mothers initiating breastfeeding in the very first hour of birth almost doubled, and the number of mothers giving pre-lacteal feeds reduced to half. This clearly made a huge difference in the health and nutrition of the babies. And also, we noticed that we were detecting far more breast and nipple problems. We were practicing skin-to-skin contact, early skin-to-skin contact in the labor room. We were doing breast scroll, everything that was ideal to support and protect and promote breastfeeding.
Well, that is fantastic, and so it just sounds so wonderful, Sushma. It's so exciting to hear that. So, can you tell me, what are you looking forward to with the future with these groups?
Well, as I would be emphasizing in my talk, and I would let my participants and delegates know that with this simple method of introduction of mother support groups, I would enumerate our success story. I would tell them about the role that they played at our hospitals, and I would want them to replicate across, the globe, both in the community and in the institutional setup, this mother support group model, which has been indigenously trained, and it is not exactly like your La Leashley group, which is there in the community, or the lactation consultants. They are somewhere in between. And with this simple, training, they are doing an excellent job of protecting and promoting breastfeeding. And I would like that this model be replicated.
Well, that sounds great. I'm really looking forward to hearing definitely more about what you've seen, what you do. It really is inspiring, and it's something that is very close to my heart. And I enjoy so much, the mother support group. But yet there always seems to be more that I can learn, about the groups. And it's great that, you have been doing this in India as well. Well, we have run out of time today, so I would like to thank you again, Dr. Sushma Malik, for being with me here today. And to our Gold audience, thanks for listening in today, and we're looking forward to hearing more from you. Thanks again. Bye-bye.
You're welcome.